Hey y'all, it's your Thrifty practitioner Tara. How are you guys doing today? I hope this video finds you well, and I want to thank you guys for watching. Today is Thrifty Thursday. Thrifty Thursday is a series of videos that I am going to be doing maybe once a month or every other month, and it will cover topics that have to do with possible budgeting and health and your health. So today's topic was supposed to be about something else, but something occurred this week that kind of made me a little upset. And it made me upset. And so I said, hey, I'm going to make a video about this because I think this is very important for a subset of people that may be my viewers or somebody's out there. And so this may not apply to everybody, but this does apply to the people that are in my subset of individuals who I see at my practice. And so, or at my office where I practice. And so the people that I see are individuals that are more so in the low income or low socioeconomic status. And they are in what we call the underinsured or uninsured population. These individuals, they live in inner cities, rural areas, possibly immigrants that are in the country. And I don't care whether legal or illegal, we are not going to talk about that. They're immigrants into this country, okay? And so we serve those individuals. And when this particular thing occurred this week, it very much it hurt my heart because there was access to things that people didn't have. That now I'm just like thinking, hey, how is this going to affect individuals going forward? Or how could it possibly affect individuals? In addition, what is something that these individuals need to consider? So let's go ahead and let's talk about this. So the first thing I'm going to ask is, do you need a medical sinking fund? What do you think? Do you need a medical sinking fund? Well, my original answer is yes. I feel like everybody needs a medical sinking fund, but it depends on actually, I think a lot of it depends on your health as well. So I basically am going to say, honestly, if it comes down, it depends. It really does depend. And what does it depend on? Y'all, I'm going to turn it this way. It depends on how often you visit the doctor. And that is just so true because I visit multiple doctors in a year. Okay. I have two specialists and my PCP. And I see my PCP twice. And so basically I'm saying, hey, if you go more than one doctor visit per year, you see a specialist or you have a known upcoming procedure, then I'm going to say, yes, you do need a medical sinking fund. You need a medical sinking fund so you can start budgeting for this and it doesn't catch you off guard. Also that you can make your appointments because it's very important that you make your appointments, especially if you have co-pays and things. And if you don't have co-pays, and you are underinsured or uninsured, then it most definitely is important that you set aside some sort of fund, even if you don't see the doctor more than one time a year, because you have to pay differently. Maybe you go on a sliding scale, maybe or maybe not, I'm not sure. But if you have a sliding scale type thing, then you may pay a little bit more. You got to take in consideration labs. For some individuals, if you have a high deductible, high insurance plan, and you really don't have a lot saved in your HSA account to pay for it, you may need to actually set up a sinking fund to cover your, to cover your lab work. Okay, which is your blood work, to cover your blood work. So those are criterias that you would say yes. Okay, you would say no if you only go annually or if you only go when you're sick, because this should be sporadic. So overall, what you're saying is I'm healthy. I only need to go for my annual visit, which is covered because of the Affordable Care Act. That's one of the things that's required is a preventative exam. Okay, and then also your labs are covered too. Your basic labs should be covered. And in addition to that, you're just going for sick visits. So maybe you don't get sick a lot, or maybe hey, winter's coming. I know I'm going to get that sinus infection. So, but you can usually cover that, okay? Another reason why you would have a medical sinking fund is because you take medications. So do you take medications? I'm going to say a person that takes medications, yes, you most definitely need a medical sinking fund, because you are either purchasing these meds monthly or you get them every 3 months. You know, normally it's 90 days. You get 90-day supply, so you're getting them every 3 months. You may have multiple meds. You may just have a couple of meds or even one med. And it just kind of helps to already have that money together, so you don't feel like, hey, I got to choose between food this month or my medication, because your medication is as important for many people as it is to eat. Okay. So I actually have a medical copay procedure. I don't have any procedures, but well, I'll say this: medical copay / procedure sinking fund, and I also have a prescription sinking fund. Okay, I go ahead and automatically save a certain amount each pay period into this fund, and I'm just building it up because I know I'm going to have my regular PCP I go to, which now that I've changed insurances, I think it's $30, and then I have my specialist I go to, two specialists I go to, ophthalmologist and my gynecologist, then, and that's $50. You know, can I possibly with my income afford it just to pay out of my pocket at that time? Yes, but I'd rather budget for it. Okay. And that's what this sinking fund is. And that's what any sinking fund is. A sinking fund is a way to save, and you do it through budgeting. Okay. I would prefer you to do a sinking fund over a savings challenge. The sinking fund, you know, you have designated this money on a monthly basis to go to a specific category. Whereas with a saving challenge, you just kind of put that money anywhere sometimes. Sometimes you may have it designated something and it goes somewhere you might have forgot, and you're just collecting a bunch of challenges. You may be waiting, and in the meantime, an appointment came up. I think it's just better that for this, it's your medical. Don't play with it. Go ahead, guys. Get it together. Get it saved. Now, for my medical includes, for me, it's going to be my PCP, copay for my PCP, for my specialist, my vision exam, my annual vision exam. Okay, with my current insurance, I think it's covered. But you know, if I need glasses, there are also certain discounts I get, but I still have to cover that. I need glasses, y'all. I don't wear them. So I do have readers, though. I do have readers. And but I also go to the ophthalmologist. And the ophthalmologist, I have to get my eyes checked a little differently. So, but that's with my copay. Now, dental is another thing. If you know your teeth really aren't that good and you want to start getting them done, you're going to start saving up for that dental. I do have dental insurance, but dental insurance doesn't go a long way. It sucks. I don't like dental insurance, but hey, I'm glad I have it. Okay. So this is something that you'll put that money in there for, as long as you know it. You can save up for it. So this is what you budget for. That means when you do your budget, you actually have a line item that says medical sinking fund, prescription sinking fund. And that's what I have here. I actually need to start ordering. I need to order my prescriptions right after I get off of this, video, because God bless, I still haven't done it, and I have one pill left. So that's what I'm going to be doing, but that's what this is for. Okay. Now, the other thing that I want to talk about is something that occurred this week that really hurt my feelings. In the prior, okay, so the first thing I want to do, and this is the part where you can kind of jump off if you want, but this is where I feel like it's going to help my uninsured, underinsured, low-income individuals. So you have two things. You have law, and you have an executive order. This is what you want. This is not what you want. The reason you want this is because it is harder to undo this than it is this. This is why it is difficult for the ACA to be attacked compared to the, how can I say this? The executive order that extended extended the ACA enrollment and and created drug pricing models. Okay, so this was my pet peeve this week that occurred. And this is where some of y'all might jump off, but I really want to help explain this to y'all, how this affects you. How does this affect you as an individual and your health care and your money? And this is very important because a lot of times we want people to do this job for us, but we really need to be doing this job for ourselves and for others. ACA is law. It can be changed, but it's going to take another law to change it or to amend it. It takes a bunch of people to agree on it. It took a bunch of people to even get there. The ACA, if you don't know, is the Affordable Care Act, is Obamacare. I don't like using Obamacare. I feel like it's a bastardized word for something that was a really good thing that occurred. Some people don't agree, but I'm going to tell you, being in the healthcare field for as long as I have, one of the greatest things with the ACA is it took away pre-existing conditions. And I'm 50 years old. When this happened, my daughter was not even a teenager yet, and she had a kidney problem. It was very difficult to get her kidney stuff covered because when you had a lag in insurance, the insurance companies did not want to pick you up. If they picked you up, they didn't have to cover that particular thing. The ACA said, you got to cover it. You take this person, you take everything they got, because that pre-existing condition is staying with them. So this insurance needs to cover it. So I loved it for that. Okay. Also, it allowed my children to stay on the insurance until they were 26. I'm not sure whose land that they believe that a 26-year-old, especially nowadays, is going to have a really good job that covers insurance. Some can get it and some don't. Some it takes a little longer to launch, or it takes a little longer for the career. So those are two things that I like the ACA about. Now, the one thing that people didn't like about it was it required you to have health insurance of some sort. That was at the time. But of course, like with anything that was new, it just kind of works to evolve into something that is going to try to get better as long as all parties are working towards it. So in the time that it was initiated into law and it got worked on, they were working towards something for 4 years. It didn't get worked on. And then during the Biden administration, he did an executive order. That executive order said, hey, I want to extend the enrollment in the ACA, okay? And also, we want to start creating some drug pricing models so we can help reduce the drug cost, okay? So let's talk about the first one, which is extending the ACA enrollment. The way they did that is with federal money. They did to help supplement these different companies that are in the marketplace. What that did for you as the consumer is it lowered the premium for you that you had to pay. Now, I know many of you were like, oh my God, the premium is so high. The premium is so high. Well, the thing about it is I just paid my Cobra for 3 months. I paid Cobra for 3 months between jobs. It was $2,500. I don't think people understand that the premium that you pay with a company is only cheap because your company covers a lot of your premium. They subsidize you. Your company subsidizes you. So your $500 premium is really $2,500. So when you're going out to the marketplace and you're paying for it on your own, you're paying full price. That's just it. You're paying for a full price premium, just like I did with Cobra. So the government came in and said, hey, we want more people under the Biden administration. We want more people to be able to have access to insurance. So what they did was they said, okay, we're going to subsidize this. And by subsidizing it, it lowered the premium and 24 million Americans were able to get insurance. In addition, there was these other things that were called Medicaid extended states, okay? Or Medicaid expansion states. Medicaid expansion states were states that expanded Medicaid eligibility to include low-income adults, okay? And so what that meant was that you could still be, usually Medicaid was just for pregnant women and also children, but it expanded over to adults. And so more adults were able to get insurance coverage. Well, that is awesome. Well, this is something that was also backed by the federal government, okay? It was a supplement, well, I would say subsidized by the federal government to the other states to, once again, increase healthcare coverage for individuals. Now, with this new rescission that the current administration has done, and they have gone in and they said, oh, no, we don't want to, with an executive order. And a lot of administrations do executive orders. So I don't want to knock this presidency for doing anything. I'm just saying what occurred was they revoked this particular thing. So they're saying pretty much an executive order, it says, it's kind of like saying, this is very general, we just don't want to concern with this. Well, this is not our concern, or we don't want to continue on with this during our administration. This is not something we want to continue with. We just prefer to focus on the things we want to focus on, and we don't want to extend funds to this anymore. So what does that mean to you? What does that mean to you as an individual that recently got enrolled, or that's in a state that is a Medicaid expansion state that covered low-income adults? You know what? That's a good question. I don't know what that means. We all know when something's no longer getting funding from the government, what usually happens is or state or whatever it is, or city, what usually happens is that program shuts down. You know, that program shuts down, and then there's a lot of people that are, you know, I can't say a lot of the stuff that I want to say, acronyms, because they're curse words, but they're just out of luck. You know, you can put the other letter with an S in front of that, but they're just out of luck. And so I'm not sure if some of these states are going to continue to move forward with these expansion programs without the subsidy of the government. So we'll just have to see. We'll have to see if this administration will continue to subsidize that program, or if they're going to say, no, that's not something we want to continue on with. We're going to take that money and we're going to fund something else. And then what is going to happen to that person, you as an individual, where things were subsidized and it was made affordable for you? I don't know. I'm not gonna lie, I don't know. I hope your state keeps it up. I know Illinois is one of the states. In fact, there's only 10 states that are not Medicaid expansion states. And I'm pretty sure you can guess where a bunch of those states are located. And if you said the South, you are correct. In fact, it is Texas, Mississippi, Alabama, Georgia, South Carolina, Florida, of course, Florida, and Tennessee. And then you have Wisconsin, which is all up there by itself. And I think the other one was, what is that? Utah? Let me see. I think that is Utah. Nebraska. Y'all, I know I got to blow this up. Girls' eyes no, it's Wyoming. So I lied about Utah. So Wyoming, Kansas. Okay. So that is it. And that is crazy. So in those states, those individuals that are low-income adults, they don't have the opportunity to apply to get Medicaid, to get medical coverage. So the great thing is the prior administration was trying to look out for Americans and the best that they could without having to put into law, because there was too many people involved and people that didn't want to do it. That person did an executive order and said, hey, this is just what we're going to do. And they did it. Now, the other part is the drug pricing models. This is what really bit my bones. This one, I haven't had time to process, but the drug pricing model is what really bit my bone and made me mad. There are 6 pricing models that were introduced under this executive order that was done under the other administration. And of those, 3 of them had not been implemented yet. And the other 3 that have been, I don't know if they're going to be continued. Once again, I don't know what's going to happen with the funding for this, because they may decide once again, they might want to do it, they might not want to do it, or they might pick and choose what they want to do. But when it comes to the drug pricing models, they were going to The goal was to cap out-of-pocket costs for generic drugs. That's what they were looking at. There was a couple of other ones, like expediting FDA approvals, reducing cost of cell and gene therapies, okay? Also, having a flat $2 copay for generics under the Medicare drug plans. And what people don't understand is things take time. Just like people were upset with the ACA when it first came out, you got to understand you had two different parties with two different views. And one party, the other side, the conservative side, really was pushing for people not to have it. They didn't want it in the first place. So, and it really sucks because this is what's actually helping the American people. And so here we go. Like I said, it's just slow roll. If they keep working on it going forward, hey, it gets better. Now, when it comes to drug pricing model, it was going to start with, if it starts with, say, like Medicaid and Medicare, what happens is usually you have these big payer programs like Medicaid and Medicare that if you can get some sort of model in place, then there's usually a trickle-down effect that also can be picked up and implemented by all of the, all of the insurances, or forced in some way, which is kind of how all this stuff happens. And so the problem is the one that I really would have liked to be able to keep is that, capping the out-of-pocket costs for generic drugs. I have patients that cannot afford drugs. I have patients that cannot afford their medications, and it's not just the elderly. People are like, what about the elderly? What about the elderly? I'm sorry. There are moms, dads, kids, because the parents don't have insurance and can't afford insurance. We have a program that we're able to utilize, but even that program, which is federally funded, a lot of drug companies have started pulling out. And now that this new administration is in, and when that person got elected in, they really started pulling out. And I don't understand, because people can't afford these medications and you refuse to reduce them. Maybe if it was made higher, they could get them. But it sounds like the biggest thing is it's just a big payout all around. It's just crazy. I just don't get it. People say the whole system is broke. It is. And when some of the government officials try to jump in and help fix it, the other group didn't want to. So y'all have to think about that. There is so much that's involved. So when it's in law, it's hard to mess with it. That's why they're able to challenge this birthright thing, because it's in the Constitution. It's a 100-year-old type of situation. Like I said, I'm not fluffing back and forth in regards to political parties. I'm not going to argue with anybody, but I'm just trying to give an example of why it's difficult for certain things to be messed with. Whereas if you have an executive order that you just sign on a piece of paper, the next person come in and they can just sign it away and say, hey, that's just not our focus, this particular administration. We want to focus on something else. We may or may not continue this, but right now we're not going to focus on this. So I'm just really worried about my patients going forward, because once again, we are a country that has the highest drug prices. It's frowned upon if you go outside of the country to get it. I cannot prescribe medications for outside of the country. I did find a medication on Mark Cuban's pharmacy that was very reasonably priced, and I cannot write a prescription for it. So, there's just all of these little laws out there that just really are, that hinder us from helping our patients. So I always tell my patients, and I'll tell you guys too, when I say to you, eat right and exercise, that's why, y'all. That is why. You will be surprised. I have had diabetic patients who were able to bring down their A1C. I've had hypertensive patients who were able to, still with their medication, but control their blood pressure. Patients with high cholesterol bring down their LDL, which is the bad cholesterol, and bring up their HDL, which is the good cholesterol, and to bring down their triglycerides just from diet and exercise, cardio and strength training, okay? And listening to me about a low inflammatory diet at least 80% of the time. But the problem is also, I can't get into this right now, but food, and how food and being in a food desert, or just having lack of money to purchase food, can also dictate what you eat and affects your health and why you have to continue to take medication. So I don't see this particular executive order that was revocated to be, I just think it is a loss for the American public. And I am concerned about what is going to happen to people and their insurance if it's not subsidized, because usually a program that's no longer subsidized, it goes away and the people suffer. And in addition to that, not having been able to have this drug pricing model actually executed or implemented, it's going to go to the wayside. And so now, where someone was looking out for us to have things capped, as far as even just generics, it's just not there. So I'm very concerned for my patients, and that's why I am saying to you, a lot of you, if you do have medications, you see the doctor more than once a year, you see a specialist, or you have a known upcoming procedure, you need a medical sinking fund. It is very beneficial for you to start one now, okay? Still build your emergency fund, but you need a sinking fund. So guys, that's all I wanted to say. I appreciate you staying to the end. I love to hear your thoughts on it. I don't want to argue politics. I'm just talking about, once again, we're talking about sinking funds. We're talking about medical sinking funds, prescription. Also, just talking about, just in general, health insurance and, I don't know, family members. You have family members that possibly are the people I serve, which is, like I said, it is uninsured, underinsured, and urban areas, rural areas. These are the people I serve. And I'm worried about my patients, y'all. I'm worried about my patients. So, all right, if you like this type of content, don't forget to comment below, guys. Don't forget to like, share, subscribe, turn on those notification bells, and I'm gonna see you in my next video.